as possible at the end of the session, because that's what we are here for. We really want to engage and collaborate and learn from each other. So we are going to today, as I said, talk about the Sussex Race Equality Transformation Programme and how we approach it in Sussex, looking at the diversity of our population and through the lens of population health management. So just to give you some background, the pandemic, death of George Floyd, Black Lives Matter, social movement, all exposed issues that disproportionately affect our communities who are from ethnically diverse backgrounds, where they do experience worse health outcomes than their white counterparts. And these events are manifestations of deep-set inequalities in our society and our healthcare systems. Furthermore, the COVID pandemic highlighted that everyone was significantly affected by the pandemic, but there was disproportionate impact on our communities who are from ethnically diverse backgrounds, who live in deprived pockets, and also who face economical disadvantage. So this evidence of disadvantage puts them at increased risk of health inequalities, which also applies for our population in Sussex. Sussex essentially is, relatively affluent region, but we do also have pockets of deprivation, again relating directly to our populations who are from ethnically diverse communities, economically disadvantaged, and living in deprived areas of Sussex. So in 2020, the Black and Minority Ethnic Disparity Programme was established in Sussex in response to the disproportionate impact of inequalities faced by our populations. We conducted a needs review, and we did that collaboratively with our partners, so our council partners, and to be able to identify where are the health inequalities in Sussex. As I said, it may be a relatively affluent region, Sussex, but there are significant areas of deprivation. So the contrast is wide, and that where our populations are impacted by health inequalities. So we were trying to identify through data-led approach where the health inequalities are and how we dismantle them through delivering our core functions. So currently the race equality, it is called the Race Equality Transformation Programme, and through the program, we are taking a collaborative approach by bringing together our providers, our EDI leads, our partners, our councils, and even our volunteer and community sector partners to grow deep and meaningful consciousness about health inequalities and how we can drive them to have tangible outcomes to inform our decisions and to improve health inequalities within our ethnically diverse populations in Sussex. So largely, what I would like to really stress here, it is a collaborative approach where we bring together our partners through the board, and we inform our decisions and step forwards to eradicate race disparities within Sussex populations. So we are taking a data-led approach through the application of population health management, which provides us the tools to be able to tackle health inequalities. Now, through that, we identify people who are at higher risk, like I was talking about earlier, our population who are from diverse backgrounds, or population who are living in deprived areas of Sussex. And we are thereby developing interventions through prevention and personalized care and applying those lenses to address the underlying health conditions, shorter life expectancy, and also recognizing that the wider determinants of health, for example, education, employment, limited access to health services, and when that intersects with sex, gender, religion, ethnicity, age, how that collectively has worse impacts on the health outcomes of this section of our population that we are talking about. So this data-driven approach and applying our tools and using prevention and personalized care approach has enabled us to understand the health inequalities and to have a preventative approach through personalized care to address the inequalities that are impacting our population in Sussex. So I have highlighted some of the tangible outcomes. So we do define projects focusing on our clinical priorities. So we do take the Core20 Plus 5 approach, where we define our plus populations, or populations who face the deprivation. What are the clinical areas that we are addressing, like hypertension, cancer, respiratory, serious mental health illness, and maternity, and as well as that, how that intersects and highlights and bring forwards the outcomes when the same section of population, ethnic minority, are living in deprived areas. So it sort of enhances the inequalities, if you like, which we are trying to approach and address through the population health management approach by drawing on community insights. So potentially, if this is what we hope and wish for, is the reduction in health inequalities by applying the population health management lens, by reducing, for example, cervical cancer deaths, stroke, breast cancer, and thereby addressing health inequalities which are largely avoidable, unfair, and produces systematic differences within populations. So we do acknowledge that, yes, we are addressing health inequalities here, but there is the larger landscape of things and factors like socioeconomic, physical, environment that all collectively impact on the population. And what we are doing through the work of our Transformation Board is safeguarding our population and our workforce who are from ethnically diverse backgrounds, broadening our understanding of social disadvantage, and how we are doing this by collectively bringing together our partners who can inform our decisions, and we can be informed by their expertise and knowledge in the area. So we are formed of 3 places: East Sussex, West Sussex, and Brighton and Hove. And we are taking this model to drive the tangible outcomes in Sussex for the ethnically diverse population. So this is just an overview of some of the work we have done. So just to give you some tangible outcomes of how we have done it. So I'll just give you on a practical level how we work. So the board meets every 6 weeks, and it is chaired by our Chief Medical Officer and Chief People Officer. It is represented by equality diversity leads from our councils, from our VCSC, voluntary and community services partners, our provider trusts. So collectively, we look at the results of our needs review, which I said we conducted in 2020 to identify where our health inequalities are. And then we report on. So we have inside information and assure the board of what action we are taking to address those health inequalities. We do look at both population disparities and workforce as well, because we do obviously realize that structural, institutional, and interpersonal drivers of racism impact not just the well-being of our population, but also workforce. So we have done our maternity equity audit. So just to put it into context, so we do look at disparities in outcomes in the maternity, the prevalence of higher deaths, or whether patients are registering to the maternity service and at what stage, because then that determines the outcome of their experience within the health service. We have also done research and commissioned this out to our voluntary community sector organizations to understand the experiences and disparities of health outcomes of the unpaid carer population within the ethnically diverse background. So, and then that brought forward certain results, which does say that there are cultural elements attached to it, whereby a lot of our population who serve as unpaid carers do not register themselves or do not identify the role of a carer. Again, largely a very Western concept. Hence, it comes out as a natural support mechanism towards your family, which you are meant to do, rather than, identify yourself as carer, look after your health and well-being, which, if not recognized along the line, then impacts on their health and well-being, obviously then making it an unequal and resulting in disparities for their health. Similarly, for the workforce, we have published our first ever anti-racism statement. We did have our Sussex Staff in Mind report back on their service, where they were offering mental health and well-being support to our staff who were working round the clock during the COVID crisis. I'm going to talk about the anti-racism training in a second. So those are just some examples of what the Race Equality Board have been cited on and have had taken action on, driving the tangible outcomes through the board. So just giving some examples of each of our places. So for example, in West Sussex, Crawley particularly is one of the areas which is populated by a large section of our culturally diverse population. And also there are pockets of significant deprivation, hence disadvantage. So again, they have done a scoping out exercise of what services are needed, what is not there. And now on phase 2, where they are acting on priorities to look at how, for example, within maternity, how the service can be brought closer to the community by making a community hub. So this then gets reported back on our Sussex Race Equality Transformation Board for us to have sight on it, and then to be able to give feedback and use the opportunity of having collaboration with our partners and learning from them to better improve our services. Brighton and Hove have done some significant work in developing their anti-racism strategy, and what I really take pride on is the collaboration that they have done to be able to have representation of the various ethnic communities in decision-making, promoting local businesses, for example, procuring and supporting and encouraging the ethnic minority community to have a say in the decision-making, and making Brighton and Hove a largely anti-racist city and place to live in. Within East Sussex, again, one example is the COVID vaccination program, whereby, again, a large amount of engagement has gone into understanding the needs of the ethnic minority community through local research and the uptake of vaccination, how mobile vaccination units were planned and then employed within the area to be able to improve vaccination uptake, thereby reducing and addressing health inequalities. We have, last year, wasn't it, Gloria, we published our anti-racism statement, which was, again, a big step to be able to understand the effects of racism and how we can support our workforce to have their say and be proud of their identities. We have also funded the anti-racism training, which addresses the role that racism plays, particularly in healthcare. And it is not just about changing attitudes, but also how historically it has played a role in impacting our outcomes as people from ethnically diverse backgrounds. So that is, again, playing a significant role within Sussex to inform our staff about racism and how they can combat and, again, talk about their own identities and experiences. Sorry. And now, before I hand over to my very capable colleague, Gloria, who is also the chair of our network, I just wanted to give you an overview of outside the board, what we already have and what we are doing within Sussex to support our staff who are from diverse backgrounds. So we have formed our Ethnically Diverse Staff Network and are celebrating our Ethnically Diverse Workforce Committee. We are doing a lot this month, and Gloria is really, really busy celebrating and really talking about our successes of working within Sussex NHS and how we are very proud of our identities. So the aims of the networks are to provide a safe space for our staff who are from diverse backgrounds to be able to talk openly about their experiences and outcomes and issues within the workplace, to identify and promote development opportunities, and how to overcome issues and how they are going to be able to talk about it, and supporting the delivery of work led by our EDI team. So I will now hand over to Gloria, who is leading our Population Health Academy and also chair of our staff network. So she will give us an overview of our work. Thank you.
Thank you, Sayanti. Did anyone have any questions around that aspect before I move on? Or we can take them at the end.
Yeah.
Perfect. So what I wanted to summarise is, I know we had a query about the approach. So very much our approach has been one of humility. And I don't know if you saw on the slide deck, the phase one, when we talked about the Core20 programme, was about understanding what the need was. So we don't just go and jump straight into the solution. We take that time to scope what is the actual need of our population that we're looking to serve. Alongside that and that approach of humility, we mentioned how important partnership is with us. So that anti-racism statement and our anti-racism strategy, that's the first ever system-wide strategy within Sussex. And that was possible through many, many hours of trying to build relationships and understanding the expertise that lies in the different organisations that we're working with. So have we done anything that special? Maybe yes, but I think the most important thing is actually the fact that we're willing to say we can't do this without you. And so that's how we're doing population health, by saying that we can't achieve anything without our partners, and we need to understand the communities that we're looking to serve. Otherwise, we're just going to put a plaster over the issue. And actually giving ourselves the time to scope and plan appropriate programmes and projects so we can demonstrate better impact. Okay, so I'll move on to my slide now. Perfect. So we've kind of gone through the approach. We've gone through different work streams that we've got. We've had to kind of go over it a little quicker than expected because of the tech issues. But I hope you've got a good idea of the amount of activity and the focus that's happening in Sussex around race equity. And so I just want to touch on some of our achievements today from the network, and then also after this I'll be talking about the committee that we recently set up. So what I would like to start with first and foremost is our executive sponsorship, and I think this has been very beneficial. So the Ethnically Diverse Staff Network has got two executive sponsors. We've got the Chief Delivery Officer and we've got the Chief Finance Officer. And why is that important? Because if we don't have that championship at the top, I don't think that we're really going to get anywhere. We could have all this on the ground activity, but if people aren't bought in, we're not going to see the change that we want to see. And so an example of this is we're actually going through a targeted operating model. I don't think that's a secret. We've got reductions that we need to deliver. And the evidence has shown that that has a disproportionate impact on ethnically diverse staff. And so by having a white ally in our executive sponsors, white allies, they're able to raise that senior level. Okay, so what are we going to do to protect our ethnically diverse staff? What are we going to do to ensure that they have the right training in place, the right interview prep, the right kind of resilience in place to make sure that they don't leave this wounded and scarred again, as has previously happened in history. And so that's one key example there. Another example as well is that they actually came to us and they said, okay, so we've got this big restructure happening, we've got this change taking place, we want to hear the views of your network members. And so we did that for a conversation, an open and safe conversation, and we also had a survey go out specifically to network members that fall under the protected characteristics to hear how we can support our staff members when we're going through this quite impactful change. Okay, again, we've been able to have our executive sponsors drive for data improvement initiatives. So we all know that we can't actually have an appropriate solution if we don't know who we're looking to serve, right? And so I don't know what the current status is here, but within NHS Sussex, I'll put my hands up, we need to be better at knowing the ethnic breakdown of our staff and recording that. And so we've got a great executive sponsor that said, well, what are we going to do about it? Are we just going to sit here, or are we actually going to make some targeted action towards increasing the amount of recording we have around our ethnic breakdown of our staff? So that's just an example there of our achievements today. And then the next one, which kind of links to this, is our network has got a clear governance structure. So we've got the Ethnically Diverse Network where our staff members can come, tell us what's working, what's not working, what they need in terms of career opportunities, so on and so forth. And then we then direct, so I'm a co-chair, I've got another chair member, and we are part of an EDI steering group, which is chaired by our Chief People Officer, who then listens to those concerns and then takes it to the relevant senior level board. So we've got a clear governance structure for, I guess, recording when challenges arise, when adversity arises, when we need to be doing things better. So it's not just going nowhere. You know, our staff aren't coming to us and saying, oh, we just feel like we can't get a promotion, or we don't really have a specific leadership programme for us. We're finding it really hard to get onto it. That doesn't just kind of sit in the ether. It's got a clear governance structure so that we can take action around the issues that our staff are experiencing. Okay, and then the next one, and I've got a video to play, is due to this targeted work, we actually have seen an increase, a positive increase in our staff survey in regards to the responses. So I'm going to play a video in a minute, just kind of what we've been able to achieve, improvements since the last staff survey due to our kind of targeted initiatives, and also really, really proud of this. So R2023 RES has seen an improvement. I'm aware that not all of us use RES, which is the Workforce Race Equality Standard, but have some of you heard of it? Yes, so this is something that, you know, is really important to us here at NHS Sussex, the NHS, because it kind of it holds the book open as to how racist we are being and how we're operating. And so we want to see that's kind of how we measure our activity and if what we're doing is effective. And so since this courage to be like, you know, what we're doing isn't working and we need to be doing things better, we've seen that the relative likelihood of ethnically diverse staff accessing non-mandatory training and CPD compared to white staff is now 1.1. Previously, so last year it was 0.21, so that is a statistically significant difference. I'm not a data person, but I know that's a fantastic result. And that's because we've been able to sit down, have the conversation and be like, we need to do something. We can't just sit here having endless conversations. Let's make it a reality. Let's actually create the future that we want to see. Okay, so I think we're going to go ahead and play the video now.
We have helped review a new wellbeing policy that our people team are in the process of revising, and we're also establishing some subgroups with a focus on improving the bereavement processes and in the midst of setting up a menopause subgroup.
Sorry, I was trying to make it bigger for everyone.
With an ambition to shape stronger and inclusive guidance and perhaps an organisational menopause policy eventually. So we've been super busy this year and looking forward to an exciting new opportunity that the new Living in Aging Well network can bring, whilst working collaboratively with our other network colleagues and the EDM team.
So we've made really good progress in race equity over the last few years in Sussex. I'm really pleased to see the number of persons from ethnically diverse background in leadership roles making a real difference. We've also seen the race equality strategy for workforce making an impact in all of our provider organisations. And also we've had some really good training and development programs like the Aspire programme for staff. So I'm really impressed and looking forward to the next few years of improvement.
Previously, we recognised that white staff are 1.2 times more likely to access learning and development over ethnically diverse. And through this recognition, we've worked really hard, and I know colleagues have worked really hard to ensure that those learning and development opportunities are more readily available and accessed by all. And it's really encouraging to see that this year our position is now changed and improved to a position of now 1.0, which is reflecting a much more equitable access to learning and development opportunities for all. So I'm really encouraged to see that this year.
Working at NHS Sussex, I'm proud to be part of an organisation that values Black females. Over the years, it's been fantastic to see the increase in positive action interventions aimed at supporting our ethnically diverse workforce to access tailored learning and development opportunities. I myself had the opportunity to access our outstanding Aspire leadership programme. It has been very supportive in developing my leadership skills and capabilities. Thank you, NHS Sussex.
We have established the EDI steering group, which reports to the executive committee and brings together staff network chairs and drives forward the programme of change. One of the highlights of this work has been the incredible growth of our staff networks led by dedicated and passionate staff from across the organisation. Together, they have engaged over 130 members of staff in our network activities, which have included events, trainings, workshops, campaign, policy development and staff support and guidance.
Disparity passports that we are currently trialling. The purpose of these will be able to list your health condition or disability to enable you to open up conversations with your line manager for the purpose of reasonable adjustments. We are currently in the process of trialling these, but hopefully should be releasing them soon.
This year for Pride 2023, we have worked in collaboration with our system partners, SPFT, SCFT and UHSX to plan and attend various Pride events across the county. This has been a fantastic opportunity to work in collaboration, but also celebrate equality, diversity, inclusion across the NHS.
Thanks, guys. And so just a little snapshot there of what we've been able to achieve by making equity a priority. Not only around race, but you heard from our chairs for the Disability Network and the LGBTQ+ network. So it is something that we're taking very seriously in Sussex, which leads me on to my next point. So a couple of years ago, we had the feedback around our ethnically diverse staff not feeling like they could access as much non-mandatory development opportunities as our white staff. And so that just started off with an open and honest conversation. And that led to us launching Aspire, which is our Positive Action Leadership Programme. We've had great feedback. We've actually had staff members progress since being on that programme. And when we first launched it, it wasn't entirely positive, actually. We did have some interesting remarks around, well, why are you doing it? You know, because everyone needs an opportunity, and that is right, everyone does need an opportunity. But what we had to clarify is that we have lots of opportunity for our white staff members, and they are able to access that. That's what our data is showing us. So we need to take some positive action around our ethnically diverse staff so that they feel that they also have the opportunity to progress. And you can see by having the bravery to kind of take that forward, we've now seen that improvement to our res data and to our staff survey data. And then last but not least, so Anton, who you saw earlier, is the chair for the SCFT, so Sussex Community Foundation Trust Staff Network. And so they kind of launched a little while ago, but it's been a kind of journey for them getting it off the ground. But in the past couple of years, they've been able to grow, introduce new members, get guest speakers, and just start to have a bit more of a positive influence and impact around their organisation. I'm not going to say that it's perfect, it's not perfect for us, but again, our approach is that we just have to keep taking steps forward. And the more we do that, the more change that we're going to see. Perfect, I'll just go to the next slide. Okay, lovely. And so this is what I mentioned earlier. So in 2021, I believe, was it 2021? We took a paper to the board. So we had a variety of different kind of celebrations going on, but Black History Month wasn't really on the map. And that wasn't quite right for us. And the reason it wasn't quite right is because it's not just about celebrating race equity over the course of the month. It's actually about looking to tackle health inequalities in the longer term. And we realised that back then, and we said, like, we need to do something about this. And so what had happened that year is that we had a core member of ethnically diverse staff members rolling out the programme out of their own time. And so we said, OK, well, if the organisation is taking this seriously, what is it that we can actually do to make sure that everyone is involved? And so that year, the board approved the Celebrating Our Ethnically Diverse Workforce Committee. And so it's a committee with a focus on arranging initiatives to celebrate and empower our ethnically diverse staff. And we've got a wide variety of representation on there, and collaboration is increasing year by year. So for our 23 programme, we have collaborated, as I think I mentioned, with our provider trusts, so our hospital trusts, our local authority within Sussex across 3 places, local businesses, Cancer UK, so National, BCSE, and you here. So, you know, Eloise mentioned that actually, because of funding, we might not be able to do a face-to-face, but we could do virtual. And we said, well, actually, we're committed to what we're doing, and we want to learn from our partners, and we want to share what we've learned. So, you know, we said, well, we've got a bit of funding. Why don't we come down and share our story? Why don't we share our approach? Because I think when we do that, when we start these conversations, we can have greater impact together. Perfect. I'll move on to the next slide. Okay, and then I know that we're kind of an hour and 5 minutes, so I'll go through this quicker than I would have liked. But another achievement today is the first ever Sussex Population Health Academy. So that's where you're kind of linking in Sayanti's work with that population health approach that we mentioned earlier. And so we're aware, yes, it's fancy terminology. I'm not really big on NHS jargon or any jargon for that matter, but what is it when we're talking about population health? What we're talking about is understanding our community so we can serve them better, right? If we just summarise, you know, there's loads of different streams. That's what we're looking to do. And we wanted to put our action and our money, what we know where our mouth is. And so we've launched this Sussex Population Health Academy, which is open not just to NHS Sussex staff, but it is open system-wide. And when I say system-wide, I mean that if you're a carer working in a care home, you can access this. If you are a receptionist at a GP practice, you can access this. If you're a cleaner working at a provider's trust, you can access this. And so I'm going to go into what it entails, but essentially it's a Sussex-wide multi-element programme. And so we launched that in August this year. So I won't go into this slide too much, but it was clear that we needed to do something. So as I mentioned earlier, Sussex has got its own types of health inequalities. Birmingham will have its own types of health inequalities, but Sayanti touched upon kind of maternal mortality. So it's not the same as the kind of national rates, which are very concerning. If you guys may have heard of that. So 3 to 5 times more likely if you're Black or mixed heritage to die during childbirth, which is not great, right? That's a national picture. And whilst that's not our picture, we still have serious health inequalities taking place for maternal, for women that are ethnically diverse. So we wanted to do something about that. And then we wanted to also kind of look at this life expectancy. So it's linked to deprivation for us. And again, Sayanti's mentioned that deprivation and race, there's an intersection there, and it will have worse impacts. So all of this data essentially saying we've got a problem, we need to do something about it. And so what we did is we launched Population Health Academy, not as a kind of one-stop solution, but as a step forward to making a difference. And so the first is an online hub that anyone can access. I mentioned that will link professionals to training, events, resources, and networking opportunities. I'll show you in a minute a bit of like what the hub looks like. Health Equity Fellowship, which I will go into also, and a system-wide training programme. The Health Equity Fellowship I want to touch upon. So this was a 9-month programme. It's currently taking place, and it was open to all employees and organisations in our ICS. So again, you can really see that we really care about that collaboration aspect, and we're looking to empower all our colleagues, no matter if you're public health or your NHS or your, it's just we're looking to work together with everyone. Perfect. Okay, so you can all check out the Academy in your own time, but that's the address there. And so what we've done on the Academy, we've tied in personalised care approaches, that health inequality element, the population health element, and the prevention element. And we're very much in that testing and piloting stage where we're looking to co-create with you guys, with our workforce in Sussex, and develop something that is impactful and relevant. And so, as I mentioned, on there, we share case studies, blogs, emergent news, and any training that's taking place that could help to empower our workforce. Perfect. And so this is the Equity Fellowship that I mentioned, and this is an exciting programme. So essentially, we've partnered with AHSN. Have you guys heard of AHSN? Yep, so we partnered with them. And we realised that in Sussex, certain groups are experiencing poorer health outcomes than others. And in many cases, this is because health and care services are not equally accessible for all that need them. And of course, you can hear it from me, you can hear from how bubbly I am about this, but we've got an ambition to tackle health inequalities and have a system that is equitable, accessible, and responsive to the needs of the residents. And we're very much aware that we've got increasing demands and pressures and limited resources. So we thought, what is it that we can do around this? Working with HSN, what is it that we can do to try and make a step towards making a difference? And so what we've done is we've recruited 8 fellows, and we're essentially supporting them and empowering them to deliver projects around specific population groups and specific health inequalities. And so whilst providing them with kind of face-to-face training and workshops and online webinars, etc., they are going to be rolling out their projects to look at understanding our population groups more and making a positive impact. Perfect. So I'm going to go on to the next slide. And then just so you can have a breakdown of the different projects the fellows are working on. So Lucy is working hospice, palliative, and end-of-life care. We've got a fellow working on primary care, digital inclusion, community care, children in care, which is big, and prescription charges. So you can see there's kind of a wide spread there of different areas that our fellows are going to be looking at, understanding, so that we can make some type of difference. Perfect. And then this is our system-wide training. So as well as empowering the fellows, and as well as empowering all of our staff through the web page, we are also rolling out this wider training programme. So we're hoping to collaborate with a variety of partners, and we'll be delivering initially three webinars. So we've got the first one coming on the 15th of November, which is around health inequalities and how do they manifest in Sussex. The second one is about understanding population health and taking that deeper dive into, well, what does population health mean to you in your daily working life? And then the third one will be about sharing good practice. So kind of looking at that national, international, regional and neighbourhood level to share that learning. Perfect. And so how are we tying race into that? Well, I just recently took this to the board and it's approved that we're going to have a specific race equity component on that Population Health Academy. So here we'll have a system-wide approach, a one-stop destination to access current updates, case studies and best practice learning around race equity. And as Sayanti mentioned, there's lots of activity taking place around the maternity equity audit, faith, culture and belief, and our race equality strategy. So again, essentially be a place where you can go and you can find all the current updates as to all the different activity we're doing and learn from that. Perfect. And not to forget that it will also be a place for networking around race equity initiatives. Wonderful. So I'm due to wrap up soon, but I wanted to open it up to you guys. We really are big on kind of learning from others, and we want to promote your work as well. So I know you guys are doing fantastic work here. So how can you get involved? Please do visit the Academy webpage and let us know how you find it and how we can improve it. So that we can support race equity work across Sussex, and we have got bigger ambitions. So hopefully if you get inspired from us and we get inspired from you, that's going to support your work as well. Spread the word, please do promote it to your colleagues and co-create with us. I'm sure you guys are all working on fantastic pieces of race equity work that we could showcase on the Academy. So if anyone wants to volunteer a vlog or a case study or anything exciting that you're working on, we'd love to showcase it on there, and I will share my email after this. Okay, and then you've got the little link there if you wanted to give us feedback on the Academy once you head on there. And that's one of my favourite quotes, which is, only when all contribute their firewood can they build up a strong fire. So what's that saying? We all need to get involved. Let's work together to make a difference. Thank you. Perfect.